Dr. Mulder, at 16 weeks old, we have Indiana here. How does his parents know when they go into a store and there's a wall of food, what is the right nutritional choice to make?
It's a tough one. As you can see, Indiana's a very energetic little puppy, so meeting Indiana's energy requirements is not going to be an easy task. He's burning a lot of calories, both with life, but also with growing. So it's really important that we choose a food that's going to meet his energy requirements and provide all the building blocks for nutrition. To that end, I've written a computer program that takes into consideration how big Indiana is now, how much food is being fed, how many treats are being fed, how big we think Indiana is going to be, and most importantly, what is the body condition? Because a 20-kilogram dog can be a very skinny 20-kilogram dog or a very chubby one.
Speaking of treats, Dr. Mulder, just how many calories are in the treats that we're feeding our pets, and how many is too many and how many is enough?
Great questions. Total intake of treats should not exceed more than 10% of the total caloric requirement. But then you have the question of how many calories are in my treat. We have two examples of treats here right now. The Medi-Treats is one of them that we carry, and each one of these ones has 14 calories, and each one of these Benny Bolis is only 8 calories. Now, if you compare that to most cookies-type biscuits that are out there, even the small ones of those are well over 40 calories, and the large ones, 120 calories. And if you want to get into some of these big dental chews, some of those have as many calories as a cup of food.
So, Dr. Mulder, we have Penny here today. She's in for surgery, and she's 6 months old. At what point are we not so concerned about her growth rate?
Well, the most important thing is that they grow properly. So when the growth is finished, we're not worried anymore. But how do you know when the growth is done? And if you watch on the computer screen, you'll see that towards the end of the curve, things flatten out. And so we'll continue to monitor, usually till they're about a year of age. And that monitoring is really important. And again, Penny is a great example. She was in last week for her pre-op assessment, and we thought she was a bit heavy. And so we made some adjustments to her feeding program, and you can see on the curve that she's actually done very well. She hasn't grown a bit in a week, and that has brought her back where she should be to slow down that rate of growth and prevent those hip problems that we're all familiar with. Growing puppies is so important. They only get to grow once. What we grow during those 6 months has to last them for life. And if they damage those joints in the growing process, they suffer with those joints for the rest of their life. So growing once, growing right is the goal.